Hello, and welcome to Reflective Feedback Conversations. This is the 8th installment of this webinar series focused on navigating the shift to competency-based medical education, brought to you by STFM and the AFMRD with support from the ABFM Foundation. Today's webinar is hosted by Dr. Stephanie Matisich and Dr. Stephanie White. Dr. Matisich is the OB Fellowship Director and core faculty member with Family Medicine Residency Spokane, and Dr. White is the Associate Program Director with Mercy Family Medicine Residency in St. Louis. During this webinar, please utilize the Q&A feature to ask questions of the panelists. Although you may ask questions at any time, designated time has been set aside to answer your questions toward the end of the presentation. We hope to see you at our next webinar, Fostering Master Adaptive Learning and a Growth Mindset in Your Program, on August 14th. You may register for this webinar and access the previous webinars in this series at stfm.org/CBME webinars. And now, Dr. White will begin today's presentation.
Thank you, Jenny. So as she said, I'm Stephanie White, and I'm working here with Dr. Stephanie Matisich, and we're going to talk to you today about feedback. We're excited to have you, and please feel free to use that Q&A box, as Jenny said. So next slide, please. We have no conflicts of interest to disclose to you today. Our objectives for this seminar. So after today, we are hoping that you will be able to describe some key aspects of reflective feedback conversations, identify how we as faculty can role model receiving and incorporating our feedback ourselves, and describe how to guide residents in self-reflection and assessment based on what evaluation data and observations they have available. Next slide, please. All right, so we're going to start off with some poll questions to ask about everybody's comfort level with giving feedback. So our first question is, how comfortable do you feel giving positive feedback to a learner? So telling a learner what they did well, what they should continue doing. So your choices are very uncomfortable, somewhat uncomfortable, neutral, somewhat comfortable, and very comfortable. So we'll give a few moments to see what our audience says. Okay, so here's our summary of our results. So only a few people reported feeling uncomfortable with positive feedback. Most of the respondents reported they feel neutral, somewhat comfortable, and majority feel pretty comfortable with giving positive feedback to learners. So great. Our next poll question, a little bit contrasting, you can probably anticipate what it's going to say next. How comfortable do you feel giving constructive feedback to a learner? So this is referring to coaching. Some may say criticism. You're telling a learner what they could do differently next time. Same choices are very uncomfortable, somewhat uncomfortable, neutral, somewhat, or very comfortable. We'll see what the difference is. All right, gets your votes in, and we have a little bit wider distribution this time. So some participants report that they do feel somewhat comfortable giving constructive feedback to a learner, but there's a higher percentage of folks who report feeling discomfort with giving constructive feedback. So spoiler alert, we kind of anticipated that may be the case. So a lot of what we talk about today is going to be about giving constructive feedback to learners and how we can make that a little bit easier. Next slide, please. All right, so we're going to start off with what constitutes good feedback? What makes feedback effective? And why is it so challenging for us to give good feedback? So just reflect for a moment, because I want you to keep an example in mind as we walk through some of these basic tenets. Think about your own experiences as a feedback recipient. We'll start off with recipient. So when have you received constructive feedback that was done well? So probably lots of people have told you good job in your lifetime, but when did someone tell you, hey, I think you should do something differently? That actually was done well. What aspects of that conversation made it helpful or positive to you? Similarly, think back on a time when you've been the feedback giver. When did it go okay? When did you have to tell someone something challenging and it went all right? Why did it go well? And then probably many people can think of a time where they had negative experiences with feedback, where they try to tell someone challenging and it wasn't well received, or vice versa, that you've been given feedback yourself on something constructive, something to change that you didn't like hearing, or made you feel uncomfortable, and it didn't maybe do what the feedback giver intended. Next slide. Sorry, Jenny, next slide. Okay, there you go. Perfect. So feedback is necessary. So we are teachers of medical learners. We are not zookeepers, but here's my illustration anyway. So, basically, we all like to think we know our own selves, but that is just not true. Everybody has blind spots when it comes to our behavior and especially its impact on others. In medicine, this can really be true because a lot of the time we are busy. Medical school and residency naturally don't allow learners a lot of time for self-reflection. And so part of our job as faculty is to ensure that they're competent. And that means holding up a mirror and showing people an accurate assessment of what exactly is going on if they don't have that already. So your learners might have good insights into their strengths and weaknesses. They might know exactly what's up. They might know when they're doing well and where they need to improve upon. And great, then your job is just to kind of coach and guide and give some suggestions. And I think most of us perceive that a learner with good insight is an easy learner to coach. However, you may have a learner who doesn't have great insight. Go ahead for the next slide. You may have a learner who actually is doing fine and does not perceive themselves as having a lot of strengths. They might underestimate their capabilities and have lack of confidence, need a lot of reassurance, have a hard time making decisions. So that's one type of coaching you may have to provide. Another type of coaching may be the opposite. You may have a learner who can't see their own flaws accurately. Go ahead for the next slide. So they might think that they're a lion, and really, in reality, they're a kitten. So it's our job to really hold up that mirror to them and show them where are their strengths, where are their weaknesses if they lack that insight. But this is really hard. Next slide, please. So humans are innately curious, especially in medicine. Our learners are curious. We want to know more about the world. We want to know how the world works. We want to learn, learn, learn. We also have this conflicting need to be accepted for who we are. And when what we learn is that we need to change, that challenges that need to be accepted for who we are. And so receiving constructive criticism about oneself is one of the hardest things that we do, because we want to know the truth, but we also fear that we're not going to be accepted. And so it's really this challenging balance between these two needs. And one of the things we'll talk about is that it's much easier for us as feedback givers if we already have an established relationship and if the feedback recipient feels like we have their best interests in mind when we're giving challenging feedback. Next slide. So we're going to use this feedback framework, and we're going to come back to this a few times. And unlike some other models of feedback, which we'll talk about, this isn't so much the steps to feedback as some tenets to keep in mind when you're setting yourself up for this feedback conversation. Now, these are all things that we should just be doing as good humans, but especially when you're giving someone constructive feedback, I want you to remember these few tenets. So I want you to be kind. This is somebody who, again, has a deep desire to be loved and accepted, just like we all do. We also need to be truthful. We're not doing our learners any favors by hiding the truth or sugarcoating things if there is a problem that needs to be addressed. And then when it comes to what's going on, we need to be curious and we need to engage our learners in the conversation about what happens next. Where do we go from here? How can we help? This is a bi-directional conversation, not a one-way street. So moving on to our next section. Next slide, please.
And
Dr. Matisich is going to take over. Yes.
Thank you, Dr. White. I'm going to start on a little bit of a detour into the next aspects and discuss a positive feedback culture. And really, this topic in itself could be a whole seminar series. And I'm just going to highlight a few key concepts because this topic really sets the stage for feedback in general. So when you think about culture, keep in mind is a set of shared values, attitudes, goals, and practices that characterize an institution. And you may be thinking about your own culture right now and take a moment to do that. And when you think about it, you may also think like it's a kind of a moving target every year with a different set of residents coming in. And keep in mind, it is a very subjective experience, and that is why it's a moving target. But it is super important to understand what your culture is in order to make the feedback that you're going to be providing better accepted for their own growth. Next slide. So one of the importance is when it is a positive culture that's around you, then your learner gets this sense of overall well-being and belonging. And when it's more of a negative, on that flip side, when it's a negative culture that they're experiencing, they actually get an increase in stress. They may even start to withdraw from what you're telling them. And it kind of perpetuates the problem because we're all just working for growth. And there's when I'm thinking about my own culture, I'm kind of thinking about the ideal culture of feedback. And what we want to be doing with that is really assisting the learner in improving their own knowledge and skills or attitude of behavior. And one piece of literature that's actually about improving environments for learners and health professionals is that it has to do with, I'm sorry. It has to do with the learning environment involves a perceived support structure around the students and their own level of autonomy for learning. And it will overall help when you can enhance this positive culture. And one of the ways to do this, I'm going to tell you next slide, is that you got to start early. And I'm sure you all have many different aspects of your program culture. And one of the key things is you don't get a second chance to make a first impression. So set the stage early, tell them about your culture of formative feedback, and that is for growth. It is for their own growth and improvements, even when it is that critical response. And one of the aspects that you're going to have to do is continue to demonstrate it over time. And as you're doing this, it's going to decrease their stress. And one of the key concepts that you're going to have to keep in mind is that it's going to be a continual work in progress because they are going to be going through residency training, and some days are hard and some shifts are long. And keep that in mind when you are giving them feedback so that you can really meet them where they are at. Next slide. So along with this culture is going to be identifying how you can role model this. And I can already imagine people being like, oh my gosh, really, we want to be role modeling? Like, that's the last thing I want to do right now. But realistically, when you think about some of the key things that you learned in your own training, whether it was an attending of your own or maybe a senior when you were in training, that role modeling that you see has been very fundamental in your overall growth. And identifying a few aspects in your own program of where this can happen will really help set that positive stage that the program and the faculty are in a growth mindset and there to support the residents. So create opportunities for faculty to be observed by a colleague for feedback. And that could be even just 1 hour of a faculty's time that day to be at that precepting desk with that faculty, just observing the faculty, or even maybe going to the wards for 2 hours. Because when residents or other learners see that you are dedicated to your own growth and feedback, it really helps support them when they are receiving critical feedback, that we're all in this together and we are really trying to improve in every way that we can. And one thing when you're doing this for faculty development aspects of it as well is capitalize on that feedback from the residents. They tend to have a lot of insight, especially coming from the perspective of meeting them where they're at. Because it's very easy to give somebody feedback, but if the learner isn't in that right mindset yet, sometimes that's that key area that you just need to help a faculty member along with. And that's why it's really important to get even peer mentors and coaches when we are thinking about how we can incorporate feedback and role model this for our residents. Along with that, you're going to want to engage the residents in this process. Next slide. And one of the things that we often do in our careers is storytell. We tell other colleagues or residents our experiences, whether it's how many patients you had to carry as a resident or how long of shifts you had to work. We share stories about things you would never think to share with your loved ones when it comes to colleagues about crazy things that happen to us. And I think that's important to also do when it comes to personal growth with feedback. Just like it's hard to receive this feedback and hard to give feedback, it's also a little bit challenging to reflect on your own moments of feedback and share those stories and how they made an impact on your own growth. And one of the next aspects will be then keeping that feedback loop going and ask for their feedback when you are helping them through this process of accepting the feedback, making change, and if they're feeling supported through this. And that usually goes by acknowledging that it's difficult on both sides, that it's not great to give somebody negative feedback, but it is necessary, like Dr. White was saying. And another key aspect of this is you can't change all of this at once. And having one small thing that you learn and start to incorporate is going to be key over time. If you think about when you first learned to drive a car, right, there was like 3 different mirrors that you had to be looking at. Now there's also a reverse camera, and there's like multiple lights and multiple levers. But as you continue to add one thing in and then another small thing in, all of it is like calm in the background while you're driving now. And that's essentially what you'll want to do when you're starting to incorporate changes with the faculty and engaging the residents in this process, is just take it one piece at a time and keep moving forward. Next slide. With the reflective feedback that Dr. White is talking about, some of the key benefits is really based off of engaging those residents and helping them become master adaptive learners. So they will improve their own self-driven change when they are having that reflective aspect. And it'll improve the entire professional practice as well. And it gives them the opportunity to learn from others around them, whether they be seniors, medical students, or even faculty. It encourages them to have that growth mindset and enhance their own wellness and resilience through this process. And lastly, I think this was just kind of setting that stage about what Dr. White is talking about that culture, and getting back to a reflective feedback framework of how you're going to be doing this is being kind. Next slide. Next slide. Being truthful, being curious, and engaging in this process. So that way, when they're having a positive culture, and seeing it role modeled, they're able to do and absorb that and start making quality in the reflective feedback that they're having. I'm going to pass it back off to you, Dr. White.
All right, thank you so much. So with that background in mind about the need for a culture of feedback for formative growth, we're going to talk a little bit more in detail about the specific things that you can do when you need to give feedback to a resident right now. Because the program culture is important background, but it is also hard to change, right? It doesn't change overnight. There's a lot that goes into it. So we'll talk a little bit more about what needs to happen in the moment. Next slide, please. And one more. All right, great. Oh no, back one more.
For one moment, I'm going to actually have you go back real quick to the reflective feedback side, as somebody has requested to see that one more time. Yep, right there. We'll just stay there for one moment and then go ahead and move on.
All right, here we go. Great. So we'll start by touching base on some of the structured feedback models that exist. So there are quite a few that have been published as an established model for having these feedback conversations. And there are many good ones. I was going to highlight two today, the ARCH model and the ADAPT model, both of which are evidence-based and have been peer-reviewed. I think it's important to find a model that your institution is comfortable with so that everyone can use the same verbiage and be on the same page. So these models can be used to give feedback to learners and to peers as well. So we'll talk about the ARCH model first. Next slide. So the ARCH model stands for these four tenets. So first, the A stands for allow and ask for self-assessment. So turning to the learner, how did that go? R is for reinforcing what has been done well. So giving that appreciation or that positive feedback when you find something that the learner has done correctly, whether that be their patient care skills, their professional or bedside manner, their medical knowledge, whatever it is you can give positive feedback on, now is the time. C stands for confirming what needs for correction. So letting them know if there's something that they could do differently next time. So maybe it was a knowledge gap that you've identified, or a way that someone could say things in a different way. And then H is help the learner with an action plan for improvement and coach as needed. If we turn to the ADAPT model, while we have different letters, it's really kind of the same idea. So the first two parts in this chart here are actually doing direct observation. And then the second four are the ADAPT model as far as that conversation goes afterwards. So ask is for asking for feedback. Discuss is having a conversation about it. So talking about what went well, what could be done differently. Then there's the other A is for clarification. So, if there's anything that was not clear about what the coach observed, or, the learner said, oh, I actually did this because I was taught this. And then planning together, that's creating that action plan for next steps. So two different models, two different acronyms, essentially the same idea. So we're going to just talk about these steps kind of one by one. Recognizing that you could use any one of these models and probably do great. So next slide, please. And we're going to keep this framework in mind, like we talked about. So the kindness and the truthfulness comes from telling the resident what they need to know in a way that's respectful to them. And then the curiosity and engagement will come in the second part when we are coming up with why they did what they did and how we can make next steps. Next slide. Okay, perfect. And just remember that, the title of this presentation is Reflective Feedback Conversations. And this is it's a coaching conversation. This is not a unidirectional conversation. What happens is that you're the coach, and the coach doesn't exist without the player, and in sports, or the musician, or whoever is being coached. And so really this is something that the learner can initiate a coaching conversation, the coach can initiate, but we're not the ones that are going to be ultimately performing, it's the learner. And so We are just giving corrections. We are reinforcing what they've done well. And we need to have a back and forth, because if the learner doesn't understand why we're saying what we're saying, or if they disagree with our observation, maybe we didn't really fully understand or fully see what had happened. Or maybe they've been working on something for years and years, and we're coming in far late into the game of what their journey has been on this particular skill. This is why this is a conversation that goes back and forth. All right, next slide, please. Okay, so our first step, we're going to set the stage when we talk to a resident about coaching. Ideally, prior to working together, notify the learner that you will be giving them feedback and figure out what they want feedback on, or what their learning goals would be for the day. So this could be at the beginning of the week on inpatient service. This could be at the beginning of a half-day session or before a procedure. This does not have to be long. You also want to ask if it's okay if you give them feedback afterwards. You want to think about where this conversation will take place, when it will take place, and the things you don't know about. So sometimes feedback has to be said really no matter what, if it's a patient safety issue. But if you're just talking to somebody about their, presentation organization, and there's not a critical patient safety issue going on, we need to be mindful of, is this a good time to have this conversation? You can be giving the world's best feedback, but if this resident hasn't eaten in 12 hours and they have to pick up their child from daycare in 10 minutes, they're probably not going to be able to listen to what you have to say. So you really need to establish that this is a good time and place, and that they're in the right headspace for this feedback. And then signpost or announce it that it's happening. We think we give a lot of feedback to learners, and learners often don't perceive that they've received feedback. And so sometimes we just need to call it out, like, I'm going to give you feedback now about how that procedure went. And I would also recommend you make it clear about formative versus summative feedback. Most of what we're talking about in this section is formative feedback. These are coaching conversations that occur when you have directly observed behavior and are giving coaching on what you see in the moment. This is not for a grade. This doesn't have anything to do with promotion, advancement, letters of recommendation. This is just, here's what I saw, here's what well, and here's how we could change. Next slide, please. So at the time of the conversation, as all of these other formative feedback models are suggesting, we're going to start with the learner's self-reflection. So you may ask the learner, how do you think that went? What parts of this went well? What aspect of the encounter was challenging for you? Or what would you do differently next time? What did you learn today? So this is the time to where you're really checking to see, does the resident's perception of how they did match what your perception is? They may have a completely accurate perception of what they did. I forgot about the contraindication to this procedure, or I omitted this part from the consent. I won't do that again next time, but I felt like the actual procedure went great. And you may agree with that assessment. They may have a lack of insight, and that's where we're going to get to in the next couple of slides here. So now that you've established that you're giving feedback, you can open that conversation. Can I give you some suggestions on how to approach XYZ? Next slide. So next step is to provide your observations. So this is the part that people have a hard time with, because we maybe don't want to hurt someone's feelings if we have something negative to say, or we're afraid it's going to be perceived incorrectly. So the best recommendations that I can give are to be really objective and just provide what you observed them do, and perhaps provide an observed impact that they may have missed. So, for example, you observed this resident glancing at their watch during a patient visit that you were observing, and you saw a change in the patient's demeanor when the resident did that. And you can just tell them, when you looked at your watch, the patient seemed disheartened or disengaged. Or maybe you received feedback from the medical assistants in the office that Dr. So-and-so is not consistently huddling or meeting up with them before clinic. And they feel disrespected, and maybe the resident doesn't understand the impact that has had. So you're not assuming the why behind the behavior. You are just stating what you observed, and then asking them to say, help me understand, tell me more about, why you chose to do that, or can I give you an example of a different way to do that? This is the part we need to be curious, and we need to be humble, because at this part we may be proven wrong. So you may have assumed that the resident glancing at their watch was doing so because they're in a hurry and they really want to leave clinic at 4:30 today. It may be that the resident has been waiting on a text message from their spouse who is at the veterinarian with their elderly cat. You don't know the why behind why the resident looked at their watch. But you need to say, here's what I saw and here's the impact. And then now you're going to have that conversation where you're trying to get to the why behind the behavior. Next slide. So this is the coaching part, right? So what's the resident perspective? Again, they may have great insight, or maybe their insight matches yours. Maybe they're providing something that you missed. You say, oh, actually, I think maybe you're right. Maybe I'm the one that's wrong and I need to go do some reading on this. Maybe the recommendations have changed since I've been in your shoes. And if your perspectives don't match up, here are some phrases that I like to use. This comes from Brene Brown's, she calls these rumble starters or conversation starters. So some scripting that you could use is to say, tell me more, or I'm wondering, help me understand, I'm curious about. So instead of saying you're wrong, you're trying to come up with a way to say, help me reconcile what my perception is with what your perception is with what just happened. This is the challenging part. I think this is the part where we really need to be curious and humble, but also recognizing that sometimes at the end of this conversation, we're still going to say, this is, oh goodness, one moment, please. This is my room that I'm in does not has automatic lights. So one moment. All right, thank you guys for your patience. This is what happens when you do webinars from your office. Okay, so at the end of the day, you may still have a resident who needs to hear a hard truth, but it is important for us to be really open to hearing their perspective as well before we make a conclusion. Next slide, please. So finally, at the end of the conversation, we should end with an action plan. So again, the resident can suggest their own action items. So if they say, yeah, I need to read more about QTC prolonging medication, then I would say, I agree with that. And you go ahead and do that. Maybe I'll send you an article to help. But this is also where the coach really has time to shine. So if you see that someone is struggling and you have resources you can provide them, articles that they could read, a video to watch, maybe a suggestion to come up with, shadowing or working with somebody who has some skills that this learner needs. This is our time to shine as coaches. And then time permitting, this is a great time to model being a feedback recipient. At the end of this conversation, asking the resident how that felt. How did it go? Could I have done something differently in this conversation to make it a little easier, to feel more comfortable? What can I be doing to help support you as a learner? So it's very meta, getting feedback on your feedback. But again, this is a great way to model that you too are a lifelong learner and that you're kind of all on this journey together to continue learning and continue growing. Okay, so next we're going to go through an example case. Dr. Matisich, if you'll read it for us.
Yeah, we're going to go and see what Dr. Green's doing as a second year. Next slide. Next slide, please. Thank you, Jen. So Dr. Green is a kind-hearted resident who you are supervising in clinic today. Faculty and staff have observed Dr. Green is often behind in clinic, and sometimes other residents end up picking up her patients at the end of the day. You are hoping to observe her time management in clinic and provide effective coaching for her. Next slide. So keeping in mind these 4 tenets of being kind, truthful, curious, and engaging, Dr. White, next slide. I'm going to ask you a question. What do you discuss with Dr. Green before clinic?
Yeah, thank you. So I would want to speak with Dr. Green, let her know I'll be supervising her this afternoon, and ask if it's okay if we focus on efficiency in clinic for this afternoon. So, in a different resident, I might ask what their own learning goal is. At this time, since we've had this feedback from others that efficiency is something that we need to work on, I would say, Dr. Green, I'd like to have you work on your efficiency today, or can I give you some coaching at the end of clinic today? So setting that stage that, we will be receiving feedback, so it's not a surprise or shock. And then this is a good time if Dr. Green says, oh my gosh, I can't, I have to be somewhere at 5:15 and or I delivered a baby last night, I'm in a bad, I can't do this right now, then we can set, okay, maybe we won't talk to the clinic today. How about I catch you tomorrow over lunch? So this is a good time to say when and where this feedback is going to happen.
All right, so next slide, we're going to be going through Dr. Green's clinic day, and throughout the day, Dr. Green took 1 hour for a patient who was scheduled for a 30-minute established care visit. The remainder of the day, she runs behind about 30 minutes. And she has not signed any notes by the end of the day. However, she did have a no-show, so she was able to catch up and finish by 5 p.m. So when you're starting the conversation, how would you begin your feedback conversation with Dr. Green? Or Dr. Green, sorry about that. Next slide.
Yeah, so like some of these models have suggested, I'm going to turn to Dr. Green first and say, reflecting on your day today, how do you feel like it went specifically in regards to efficiency with getting through your patient encounters? Because I'm curious to know what her perspective is. I know what my perspective is when I kind of see how her flow was throughout the day. I can see some places where we might be getting bogged down, but I want to see what exactly happened in that room when I wasn't directly there and what we can discuss next.
Okay. All right. So Dr. Green's perspective was that she had a hard time saying no to patients and ended up addressing 3 acute complaints and going over multiple chronic medications for the new patient, as well as ordering preventative screening exams. She does not seem too concerned, though, with this issue because, after all, she did catch up. And yeah, so now she's still on time. So what would you say to Dr. Green to provide any sort of coaching or strategies for improvement on this?
Yeah, so this is the part where, she shared her perspective and now it's my turn to share my observations. So I would start with the objective facts and say, it sounds like, you were able to do a lot for that new patient that you saw today. But, the impact is that you did run about 30 minutes behind for the remainder of the day. At the end of the day with that no-show, you were able to catch up. But I would maybe turn it around and say, what would have happened if you didn't have a no-show? Or what would have happened if, if one of your other patients was equally as complicated as that new patient was? So you end up spending another hour. Has this been a pattern where it's hard to say no? So I'd kind of start with getting a little bit more improvement and try to let her see the impact that while for her, she feels like everything is okay because she finished on time, the patient who had to wait for a long time may not perceive the same thing. And what I'm seeing is I'm seeing a pattern of behavior that if we don't address, she may end up in trouble later on as she gets more and more complex patients and has a hard time navigating those visits, having a hard time setting an agenda at the beginning. So then I may turn and ask a little bit more specific questions about, tell me what you do to set an agenda for your visit at the beginning and start with that. So we're taking what is a bigger problem, running behind, and trying to say, is there some action step that we can come up with here? So hopefully in this conversation, this is kind of back and forth. I'm still trying to gather some more information. Perhaps Dr. Green says, oh, well, I saw that the patient was here for their physical. So we started with that. And then they just kept adding this and this and this. And after our conversation, it seems like she's not really agenda setting. Then now we have an action step that we can move forward with. So perhaps we say, okay, let's practice next time you go see a patient. What are you going to say at the beginning of the visit to really set that agenda for the day and try not to deviate from it if you can? Or what's some scripting or verbiage you can say when you have a patient who's trying to do too many things. So really, this is the back and forth that if we had a Dr. Green here, we could illustrate. But that would be some of the things that I'd be thinking about as we go through this conversation.
That's great. Dr. White, one of the questions in the poll even mentioned working with residents, and sometimes they're not specific in getting what they want to work on, or they struggle just coming up with an idea. I think you hit on a few aspects of trying to target specific aspects of the clinical experience, such as agenda setting. And I think we'll get a little more into that at the end, just for Susan, who's out there. Essentially, becoming more thoughtful and having the residents become more thoughtful by breaking apart the different aspects, whether it has to do with the agenda setting, creating the note, getting any part of the notes done, maybe communicating with the MA. And we'll kind of come back to that in a little bit as well. So
Yeah, if I could chime in
yeah,
as well, because I have yeah, that's a great question. And so sometimes I would say, like in this case, if you have a resident where there's been a deficit that's been identified, you know, maybe the learning goal is a little bit more driven by the faculty if there's someone that needs some help in an area. If it's their average person who just is in clinic and doesn't have a specific learning need, sometimes I try to remember that our learners are not, sometimes we don't really spend a lot of time teaching people how to learn or what are all the different aspects, or they look at the milestones and they don't, they don't resonate. Oh, this communication skill really translates to how do I provide reassurance to a patient in an effective way when they have a non-concerning problem. So really breaking it down, making it more specific. And then, so if I have a person who's just kind of give me that deer in headlights look, like, I don't know, I'll just throw out examples like, do you want to work on your presentations to me today? How about your efficiency, your timeliness? What about your communication with the MAs? What about, let's look at your clinic and see, oh, you have a diabetic follow-up. How do you feel about, you know, making sure you're doing evidence-based guidelines for your diabetes? So sometimes they need a prompt. So if they don't come up with anything, I will give them a list and say, how about you pick from one of these things and we'll just focus on the one thing. So sometimes our junior learners have to have a little bit of prompting to pick a learning goal. But I would say, again, this is a place where we can really shine as coaches to say, look at all these opportunities we have for learning. Let's pick one to focus on today. I don't know if that helps. And I think being in the habit, like if they know they're working with me and I'm going to ask them this question, people will start to come up with things before I ask. So I think it's just being that, yeah, staying on them.
Especially if you pick something that they don't like to work on or they don't want to have shown on them, then they definitely start coming with their own ideas to work on. But truly taking apart each step of that is very helpful. And I agree completely. They need a small prompt of, okay, so communication with your MA, is it communication while you're in the room and she's out of the room? Is it before it, right? Like, then you can really fine tune just that small thing to focus on for the day. And it gives them intention. And when they have intention with their work, it's a lot better because they then have that goal to meet and succeed. And it ends up creating that positive reinforcement for them. Dr. White, I'm going to have you kind of put it all together for us. So next slide.
All right, great.
Slide.
Okay, let's keep rolling. One more slide, please. Awesome. So we talked a little bit about, most of our conversation so far today has been about this formative feedback. This is feedback given after you observed a resident in the moment, and this is a coaching, like, here's what I saw, here's what I would suggest for next time. Another role that we have as faculty is doing summative evaluations. So just to remind us all of the difference, formative feedback is that coaching. It's low stakes. So it's not for a grade. It's not for any sort of promotion or evaluation. Formative feedback should be done frequently. Should be something that's a routine. This is just sort of what we always do. We're always checking in. And the audience or the person who you're giving the feedback for is the learner. This isn't really for anybody else's benefit. This is for the learner to improve. Contrast that with summative feedback. This is what we're more used to thinking of when we think of feedback, because we're thinking evaluations. So it's evaluative. Is this learner meeting expectations? Are they ahead? Are they behind? This is higher stakes. A lot of programs use rotation evaluations and milestones and things like that to determine whether or not somebody can be promoted to the next level. And then the audience is the general public. At the end of the day, we as medical educators are responsible for ensuring that the people who we graduate are ready to practice safely and are ready to be doctors out in the community. So this is the important part. Next slide. And I'm over here trying to plug my laptop in. So the same principles really apply when you are doing summative feedback conversations. So you're going to want to set the stage, set a time to sit down with your advisee and say, hey, we're going to go over your rotation evaluations. We're going to make your individualized learning plan. When's a good time? You want to ask the resident how things have been. What challenges have they had? What strengths do they find that they have? You want to provide observations. So in this case, it's not just going to be what you observed, but what everybody has observed. Sorry, plugging in my laptop. Thank you all. So what everyone has observed. So rotation evaluations, ITE scores, evaluations from patients and staff. And then based on what you see, you can kind of summarize that, right? So reinforcing what's been done well. Hey, everyone really compliments your bedside manner. Your patients really love you. Everyone really enjoys working with you. And then, it looks like you've been having a hard time staying on time. So let's talk about how we can work on efficiency and provide that coaching on a bigger level than what you would do. So this is going to be a longer conversation. A formative feedback conversation can take 5-10 minutes maybe here and there, sometimes even shorter if it's you're walking out of a patient room and you tell them 2 things that they did well or that they did poorly, right? Or could do better, I should say. And then at the end of this session is when it's really time to create those next action steps. So if you're sitting down with your resident advisee and you find that they recognize that efficiency is not just a one-time issue, but a more chronic problem, let's talk about what your next steps are going to be. What are you going to practice? What are you going to read? Who are you going to work with? And creating that individualized learning plan to really target what this resident needs for their next steps. So this is taking the same principles that we did for those formative conversations and just applying them to the summative feedback to have a conversation about where is this resident at and where do they need to go from here. So one more time, just so you don't forget it, these are our tenets that we keep in mind. So during all these conversations, right? So we have to speak the truth. We have to speak the truth with kindness. If we don't, the truth is not going to be heard. We need to be curious about where the residents are coming from and what their perspective is, because they very well may enlighten us to what's going on in their life. That really explains a lot of what's going on. And then we have to engage them in their next steps for how they're going to move forward into the position that they want to be.
So the next steps, next slide, and are going to be some take-home points. And that's giving effective feedback is hard, like Dr. White mentioned, but it is necessary. It's for the safety of the general public as well as educating your residents. And create that effective feedback culture and making sure that you're walking the talk. When you guys are role modeling how to receive and give reflective feedback, it will help normalize that culture and foster more growth within that resident. And when giving feedback, like Dr. White just mentioned, be kind, truthful, curious, and engaging. Some of the tips to start incorporating would be to set a small personal or even programmatic goal, next slide, to give constructive feedback on a regular basis using those principles that we discussed. Ask the residents for their feedback regularly and incorporate it. And don't forget to share those stories of personal growth, even as it relates to feedback with the residents, not just the fun, exciting ones or the crazy events that you saw, but those ones that actually did help with your own personal growth. And asking for feedback from a fellow faculty member would be another way. And somebody had mentioned in the chat, is there an effective way to give faculty get more comfortable with giving constructive feedback? And I think that this is one of the ways, is have you work with your peers. When a faculty can do this for one another, it makes it much easier to give this material to a resident. And even being the recipient of it, it reminds you what it's like to be getting this feedback nonstop while you're having pressure on you. Do you have any other thoughts, Stephanie, in regards to having ways to get faculty more comfortable with giving feedback?
Yeah, I think this is a challenge for a lot of people. It's why we're talking about it today, right? So I think normalizing that this is hard. It's okay if we find this to be uncomfortable. It's something that is necessary, so we have to lean into it. And then I think, providing some faculty development on it, and really the best thing that I did, the most learning that I received was when I had gone to a conference at the ACGME about faculty assessments. And one of the activities that we did was that there was a model resident and a model patient. So I observed their interaction. I gave feedback to the model resident, and then people gave me feedback on my feedback. Was it uncomfortable? Yes. Was it time consuming? Also, yes. But it was extremely valuable to really get other people's perspective into things that I did not notice, body language maybe that I didn't perceive that I had, or a nervous giggle or things like that, was really valuable. So if you can find time in faculty development to really normalize, like, hey, we're going to watch each other and we're going to give each other feedback. Will everybody love it? Probably not. Is it going to be really valuable? Probably yes. So I think doing some dedicated education was the most valuable for me.
We're going to get on to a few more questions and answers. I think, Dr. White, you were kind of mentioning a few of these, but any tips for finding opportunities to provide residents feedback despite our time constraints in clinic or the hospital?
Yeah, I'll give my perspective. I'd love to hear yours as well. So I sometimes, depends on how your hospital structure is set up, but sometimes I will pick a resident in on the inpatient service and I'll just go together with them for a couple of encounters. And our hospital is so large that we spend a lot of time walking in the hallway. So frankly, for this little formative feedback here and there, I'll just talk to them while we walk. I'll be like, hey, I just want to tell you that I really like the way that you explained how Xarelto works to that patient. I think it was clear that the patient was following, asking good questions, et cetera. Just chit-chatting while we walk on very specific things. I had to make it a routine for myself. So at the end of each clinic, we have an evaluation form in my residency that we call shift cards, which is meant to be a short formative feedback. Here's what you did well. Here's one thing you can work on. And I don't like doing a shift card if I haven't spoken to the resident about the things that I'm putting in writing. And so it's been a mindset change for me to say, I'm not leaving until I've given everybody their 2 minutes of what I have to say and doing my evaluation. Again, would I like to leave the office? I sure would. Am I making a mindset change? Because I know this is really what I'm here for, is to do this coaching. Yeah, so easier said than done. Dr. Matisich, any thoughts on the time constraint?
Yeah, I think one of the time constraints in my brain is actually the pressure that I put on myself and trying to correct everything at once, and that's not appropriate. We have an idea of what a graduating resident should be, and we have to keep in mind what is the steps and the building blocks that get you to that position. And so when I'm precepting, I try to focus on one thing for one resident at a time. And that may be it in an entire half day or an entire day, because that is all, like, they are already self-driven learners and adjusting to what they're doing and seeing. And making sure that I'm not overwhelming them with feedback is important. Not taking up tons of time, meaning, again, I just need to limit it to 1 or 2 things, because that's all they really need. And tomorrow they're going to come back and you can work on another thing tomorrow. And so if it's critical, obviously you have to step in at a certain point in time, but the majority of things are learning their style and how they can develop their own skills. And I think that for me has really helped. I don't feel the pressure to get it all done today. And I know that my colleagues are great and they're picking up on different things and telling them something different on another skill set. And so I think that is the biggest thing for me, as well as my own comfort level with it. It's like, oh my gosh, there are 17 things that I could comment on right now. I'm going to let the resident pick something through reflection of, hey, how'd that go? And then that's the one that I utilize to give them that feedback on. Because those other ones, they'll get to them most likely. It's just not as high a priority on their mind at that time.
Absolutely. One thing at a time. Otherwise, we get overwhelmed. Same thing goes with our patients, right? So wonderful. We have a bunch of good questions in the chat. I'm gonna ask you to comment on this one. Is there something called too much feedback? When we discuss formative feedback regularly, don't we run the risk of becoming repetitive or complacent? Any thoughts on that one?
Yeah, so I guess there is too much feedback. As we've started, as you mentioned, like highlighting, we are giving feedback now. Some of our residents have actually been saying, this is too much feedback. Please stop. I don't have time for this. And so, yeah, that can also be overwhelming for the resident. But I think when you have the small subtleties of it in that culture, it doesn't feel like feedback. It feels like a safe place in a home where you're learning things instead of feeling that aspect of this is feedback. I did something wrong, right? It is instead, oh, here's another way to look at it. Or this is how your colleague did it, and they thought that it didn't work very well either. Like, right? Sharing each other's struggles, sharing each other's strengths has really helped with that aspect. Because, yeah, it can feel like too much feedback. And I think it also has to do about meeting the resident where they're at that day. Just like some days I am running behind. And so I have to recognize I need to put this down and not let that interrupt my whole day and make my feedback be less effective. Same thing, I have to recognize I had no idea that resident's house just got flooded, right? They are not thinking about patient care today. So when I'm giving them feedback, I really need to know where they're coming from that day. And it's a simple question of, how are you doing right now? How is your day today? And usually you can tell, you read your patient's body language all the time. Just like you read residents' body language too, you can tell something is up. And I think that those are key aspects of knowing when is too much feedback or when is probably not the right moment. What about you, Dr. White?
Yeah, I think, I think that's exactly it. I think, we need to take it in tiny little bite-sized pieces. And I think there's a difference between, there's such a major difference between evaluations and conversations. So evaluations, there's for sure too much of a thing. I mean, if I have 25 evaluations in my inbox and they say I all got 3s and 4s, that's really meaningless to me. And it doesn't matter. And I do become like completely numb to it. I wouldn't care anymore. But if I'm having lots of conversations like, oh yeah, you know what, I normally recommend losartan in this case because this patient has diabetes, and they should have that for their blood pressure. And I normally do this. And if these little tips, this is the meat and the nuggets that residents want. They want to know that the more specific you can get with your coaching, that's what they need, because this is the real practical stuff that they need to get through their day. So I would say keeping it small, keeping it practical, is going to make it feel more of like a conversation and less like an evaluation. Stephanie, we have a couple good questions in here about what people would describe as maybe challenging learners or difficult learners. This is probably the last question we'll have time for. And I don't know, we'll really have time. We need a whole nother session on this, but what do we do if a resident is apathetic or is, maybe indifferent, doesn't seem to feel the need for coaching? I find this to be really challenging. And again, I've been to a whole hour-long talk on this topic, so we probably don't have time to answer it fully, but any insights before we let our audience go?
Yeah, I think part of it has to do with some of the people are pulling back, and it's because they're not feeling like they're going to be supported if it's a negative feedback session or just a critical evaluation. And some people really aren't as mentally strong to accept and start that growth mindset. And when they're not in that growth mindset, it is challenging to get them to that. And honestly, sometimes what I do is I talk to them just about growth mindset and what that is and what it looks like, because they may not even know how to show it. They may be thinking, oh, other residents just know how to do this. And that's what they're expecting of themselves. And it's an unrealistic expectation. And sometimes those conversations are what will actually hit home. And I think sometimes when it has to do with the difficult learner, it ends up being part of their individual learning plan and does take extra time to develop what will work for them. My program, we have a couple of different aspects of surveys that the residents may do so that I can figure out what type of learner they are, how they receive feedback. I also have a book that I use, which is called For Your Improvement. And it totally highlights out for me what it looks like when it's done well, what it looks like when it's done wrong, and why it might be done in that way. And another book, what's the other book that I just read? I'll have to get back to you on that other one that I also use. I wonder if it's, the other one that I use is The Remediation of the Struggling Medical Learner. Those have been very helpful in the last couple of years as I've been developing some of my own skills. What about you, Dr. White? Any other thoughts? Last thoughts?
It's 1:01 p.m. So I would say, yeah, if a resident doesn't have good insight into why something is a problem, providing the impact, I think, has been helpful, because most people are so focused on their own intentions that they don't sometimes see the bigger impact. So I agree, talking about growth mindset and explaining why we're even having this conversation is key. And then just providing the impact that maybe some behaviors have on everybody else. But that's a difficult question, and I'm glad it was asked, because it needed to be, but that's a tough answer.
Yeah. I want to thank everyone for joining us today, and keep in mind those 4 tenets, because I know it is often difficult to just keep that unconditional positive regard of the residents when you're working with them day in and day out. And that will be a key to help that culture grow and those residents start developing their own skills to develop further and ask more questions. Thank you.
Yeah, thank you all.